This is Tom Salami from OIS-TV. I'm very happy to be joined by Bernhard Günther, Managing Director and Chief Executive Officer of Novaliq. Thanks for joining us.
Hi, Tom. Thanks for inviting me.
So I understand that the second part of your title might be changing in a couple of weeks. You had some news last week about bringing in a new CEO. Can you tell us about that?
Yes, sounds that you have seen the press release last week.
Yeah.
You are absolutely right. So we will have a new CEO November 1st, as of November 1st, and I will change into the role of Chief Innovation Officer. I'm very happy.
You look very happy.
I'm very happy as a co-founder that I will stay on board.
Sure.
And the new guy is Christian Röske, with an enormous background in ophthalmology, almost 25 years background in general management positions at Alcon, at Bausch & Lomb, and I think he will bring in the expertise now we need for the next levels of the company to reach the next levels.
This is like putting your baby on the school bus, right? And letting them, like, waving them as they go out.
Correct.
Someone else has to take over now.
I'm happy to see this happen.
Excellent. So, and you also formed a scientific advisory board, so things are really starting to come together for Novaliq.
Absolutely. So we have formed the scientific advisory board recently, so 6 weeks ago, and we have glaucoma experts now in, which is Professor Pfeiffer from Mainz University. We have a great dry eye disease specialist in with Mike Stern and Katsuo Tsubota, and even Klaus Kursieven, which is focusing on corneal inflammatory diseases as well, from University Eye Clinic of Cologne, and Katsuo Tsubota from Keio University. So all great experts.
And you seem to be in the crosshairs of the intersection of a lot of excitement around dry eye in particular. There's so much going on there. How has that impacted Novaliq? Are you sort of feeling buoyed by all the talk? And,
we are more positive than ever, as we have, based on our ISOL technology platform, introduced the first product last year. It's exactly 1 year ago into the European market. So as an OTC, artificial tear, addressing evaporative dry eye disease, which is massively underserved. And in parallel to this, we have now an advanced phase 2 study with the cyclosporin product, which is not a generic because it's a crystal clear solution. All others have milky emulsions, so that's very much a big difference with the improved penetration behavior. We have shown in preclinics order of magnitude higher penetration into relevant tissue, and we are keen now to see the data of the phase 2 study coming out end of this year, early next year. So this is our most advanced RX product.
And you've completed your enrollment of your phase 2 trial, right? In cyclosol?
Absolutely. Yeah. So all the study is finished. It's just about getting the data and interpreting the data. So we are waiting for this. This took several weeks more, but latest end of this year we will have the data on the plate.
That's terrific. So things are really moving along. And this new Chief Innovation Officer, is he any good? Is he going to create some new products and new pipelines for?
Yeah, absolutely.
For Novaliq?
Absolutely. That's the story behind, to be honest. So it's a unique, really disruptive technology platform, ISOL, and of course you have more opportunities than just dry eye. So we have started early preclinics in glaucoma and in retinal diseases, or the even bigger indications in ophthalmology, and there are several other options around.
Excellent. Well, I can see the enthusiasm in your eyes. It must be a nice transition to hand off the reins to someone else to kind of take it to the next stage and allow you to work with the fun stuff, which is always the early
This is definitely how the whole executive teams see this.
Excellent. Well, thanks for joining us today.
Thank you very much for the interview.